Hello friends, Dr. Mitnaul, your friendly neighborhood child and adult psychiatrist, and we're back for another episode of Explain This. These are the episodes where I try to spend some extra time talking about some particular kind of cornerstone pieces, things that people might misunderstand or not really know very much about, and often it drives from our Diagnostic and Statistical Manual, the DSM-5, which is kind of the Bible in psychiatry. And so the book and all is probably, 950 plus pages. And so I've read it so that you don't have to. So we're going to spend some time muddling through, not really muddling through, but I'll help synthesize some of the most important parts for you to know, either to satisfy your own curiosity, or maybe you or someone that you know might be struggling with it, and to give you a little bit of context, at least from a psychiatric perspective. So let's jump in. So you may be asking yourself, where have I heard about this? So speech fluency has been in the headlines just in the last year. You might remember that President Biden remarked about his struggles with stuttering as a child. There are a host of celebrities who have talked about their experience of stuttering, such as Mark Antony, James Earl Jones, Ed Sheeran, to name a few celebrities. And so, but few of us really think about it being a part also of the Diagnostic and Statistical Manual of psychiatry. And so let's take some time to explain what we often refer to as childhood-onset fluency disorder. Now that brings us to our question of the episode. I know you were ready. So I want you to name this person. He was the last emperor of India, whose stammer was the subject of an Oscar-winning film in 2010. Now I know what you want to do, but resist the urge to Google it. I promise you, it'll wrap into all the things we're talking about today. So that's your question of the day. Stay tuned and we'll talk about it near the end. So the name that we give to stuttering is either child onset fluency disorder or adult onset fluency disorder. And that's really our long name for stuttering. So how do we define what that means? Well, this diagnosis, it's important to know, relies on a couple of things: taking account of a person's age and their language skills. And they have to have one or more of these following features in order for us to call it a disorder. Are you ready for the list? Because the list is a little long. Right, here are the 7 things. Now, as we go through these examples, I'm going to try to give you my best impression of examples. I'm not really going to do a perfect job, as I am not a speech therapist, but please bear with me, because hopefully they'll help illustrate what some of the struggles look like. So the first might be sound or syllable repetitions. So for instance, you can think of the word won't, right? So someone who might struggle with the sound repetition, you might hear whoa, 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 won't, right? So several repetitions of that early consonant before they can get out the full word. So there may be repetitions of particular sounds, like the consonant or the vowel of a word. So take the word what, for instance. Someone may get stuck on the W sound, so you might hear what, right? Or if a child is saying daddy, to give you an example of a vowel, it might be daddy, where the A is held out. Now again, we know that kids can have variations in speech too, but repeated patterns of this, and it's intruding or impeding in your ability to be able to understand them and for them to be able to communicate with you. That's where the difficulty may lie. Another feature of a speech disorder can be broken words, where there's a pause between a word and that isn't naturally inserted there. And so you might think of the word piano, and so you might hear piat and then no, right? And so separated by kind of an unnatural pause that wouldn't be customary in typical English speech. There may be an audible or silent blocking. And by blocking, we mean that there's a pause in speech that might be filled by a sound, where someone may have difficulty finding a word. Now again, you might say, isn't that a normal variation in speech? And certainly it can be. But again, these are attributes that we're seeing that slow someone's down, their pace of speech so significantly that they find themselves struggling in work, school, home, relationships, that sort of thing. Circumlocutions. So that means a word substitution when someone is trying to avoid a more problematic word. So maybe someone, has those repeats of a consonant sound or repeats of a vowel sound, and instead will kind of go around a topic or speak around a word just to avoid engaging in the word that might get them stuck. Another feature of a childhood onset fluency disorder may be what we call monosyllabic whole word repetition. Okay, so that's a super long word, and so let me give you an example. And again, there are variations in speech which may be normal. So hearing these examples, I don't want anyone diagnosing their friend, cousin, loved one, even their own child. If you have concerns, certainly make sure they get noticed. But this one in particular can be a feature that we see in young kids that can be normal, but we're looking at, where are the places where children are getting significantly stuck. So monosyllabic whole word repetition might sound like this. I see her, right? So the child might be repeating, speaking of themselves, referencing themselves, but really getting stuck on that word, and so you hear it, half a dozen times before they're able to complete the sentence. So for us, in terms of the diagnosis in psychiatry, it has to have at least one of those 7 criteria. And also, common to these, that they can really cause anxiety about speaking, and it can really negatively impact someone's ability to effectively communicate. In the case of kids and adults, that may mean that people will avoid situations where they have to speak, where they have to put themselves out there in terms of a public performance. So teens may want to be in a club or extracurricular activity, but may avoid it. There are people who might be well suited for a particular job, but if it comes with any interpersonal conversations that might require them to speak a lot, they may avoid those things just to avoid standing out. So for childhood onset fluency disorders, it has to occur clearly during childhood. And lastly, the speech pattern can't be the result of some other causes of a speech disfluency. And there are many things actually that can otherwise limit or impair someone's speech, especially in the way that they speak fluently. And so here are a couple of examples. So someone could be suffering from a stroke, right? So that can have, depending on where the stroke is, can affect some of the language centers of the brain as well, and cause some of these patterns that we described earlier. A tumor, so certainly that is a mass that of cells typically somewhere in the brain that can also impact some of the language centers. And then trauma or other medical conditions. So there are some metabolic things too that can cause for really unique changes to speech as well. And so it's important too that we make sure and investigate that we don't have any clues that signal these things might be the cause of someone having some what we call speech disfluency or difficulty with stuttering. Now, you may be surprised to know that the expression of some of these difficulties, so whether it's repeating the consonant or the vowel or inserting pauses where maybe they shouldn't naturally be, it can really look different from person to person, and it can look different depending on the context. So there can be a child suffering, with stuttering that we don't really see nearly as often until they're put in high pressure situations like being in a spelling bee or someone interviewing for a job. So often there are things that are that some of these features actually may be muted, such that you don't even hear them very much at all if someone is doing something scripted. So if they are doing oral reading, or there have been singers or performers that you don't hear it at all in their singing voice, even though in the spoken word they might struggle in this way. So in kids, it's not uncommon that kids with fluency disorders may also struggle with involuntary movements as well, like eye blinks, like tics, like tremors, head jerking, or fist clenching. Now, most young people with the disorder will have developmental stuttering by the age of 6 typically, and it usually starts though between the ages of 2 to 7. In kids, we often look for signs of masking those difficulties, right? And so what do I mean by masking? Where kids might be answering your questions in very short and succinct ways when you know that they have more of a vocabulary to kind of express what it is that you're asking of them. Now again, our children can also be guarded for other reasons that don't have to do with this, but it's one of those things that we're kind of mindful of when we're evaluating kids to ask, I wonder what that is that's causing them to be inhibited in the way that they talk to us. All right, so here's the good news that the literature currently suggests that 65 to 80% of children recover from dysfluency. If a first-degree relative had a childhood-onset fluency disorder, then those individuals are, in some cases, 3 times more likely than the general population to struggle with stuttering. Now, as I've said earlier, there are normal variations of speech that can make people concerned when there really is nothing there. So, for instance, what young person hasn't said, I want marshmallows, kind of a couple of times, just because their excitement and exuberance has moved faster than their brain is able to kind of keep pace with. Again, other things too that we look for, especially when looking at kids, is we may look at their, to rule out any kind of hearing impairments or other sensory issues too that can make it seem like a speech thing, but maybe there's something else going on below. We also look out for Tourette syndrome, which we can talk a little bit more in a future episode, but suffice it to say, both motor and vocal, what we call tics or involuntary movements and vocalizations that kids might engage in. All right, there you have it, my friends. I hope you've learned a little something. As always, if you or someone you know may struggle in this area, let your primary care know. Let the pediatrician know. And they can likely steer you or your loved one towards a specialist that can help kids establish better fluency in this area of their lives. Now for your question of the episode. So I asked you to name the person who was the last emperor of India, whose stammer was the subject of an Oscar-winning film in 2010. Got it? Are you ready? The 2010 Oscar-winning film is entitled The King's Speech, which followed the story of King George VI, played by Colin Firth. I highly recommend the movie if you've not seen it, though it's not particularly one for children, as I remember. Anyway, check out your favorite movie vetting site before you decide, who are the appropriate people in your life to watch this film with. In the incomparable words of my favorite disfluent character on television, that's all, folks. So check out the link below for resources and a list of famous folks who you may not have realized have had a history of stuttering and found ways to persevere and live a full life. So anyway, thanks again for watching, my friends. I want you to take good care and please be well.